My name's Jo and I'm 39 years old. I was diagnosed with tricuspid atresia at 4 days old. Tricuspid atresia is where atresia just means absent, and tricuspid is referring to the tricuspid valve, which sits between the right atrium and the right ventricle. So I don't have a right ventricle. I have a right atrium, which is quite big. So essentially I have what's called a univentricular congenital heart condition. I've been a Brompton baby all my life. My parents, it was a shock for them because I was born in the 70s and there was no sort of prenatal ultrasound scans like they have nowadays. So it came as a shock to them that at 4 days old that I was a bit blue, so they knew something wasn't quite right, but at 4 days they discovered what it was, so a bit of a shock. When I was 4 years old, I had a Fontan operation, which was a complete success, and I was one of the first children to have that done. Being in hospital as a kid was quite scary. Different on a children's ward from an adult ward, because obviously people take more time to explain things to you, I think. Plus it was, back in the 70s, and nursing was different from how it is now. That's changed a lot, and I've been a terrible sleeper all my life. Apparently it took me until I was nearly 5 before I actually slept a night through. So that meant that I was pacing the corridors at 4 or 5 in the morning, and so the nurses would sit and have hot chocolate with me just to try and make me go back to sleep. Patient days are really, I think they're a brilliant idea, and it's the first one I've been to here at the Brompton. I think it's really important for patients to have the opportunity to hear about things. It's really important to ask questions of those people that are treating them, and also to learn a bit more about what happens, because obviously, you know what happens in your own heart, but it's also really interesting to know what happens in other surgery, or what might be on the horizon, what might be on the horizon for you, sort of down the line. I think for the future, there's lots of interesting things on the horizon. Listening to things that were at the day-to-day, about new mechanical hearts, new ways of implanting devices and things like that. It's really exciting, and medicine is exciting.